Hello and welcome to the COVID-19 Global Update. I'm Layo Adegoke. Here's what's coming up on the program. It appears COVID-19 is impacting budget decisions as Delta State gives its consideration in its 2022 budget and Jigawa State allots more to the health sector. South Korea is urging the uptake of booster shots as severe COVID-19 cases surge to highest levels. Thank you for joining us at this time. The United States of America has opened her borders to fully vaccinated international travelers, and as the Yuletide season approaches, many are getting ready for travel within and outside Nigeria. The Nigeria Center for Disease Control is, however, cautioning everyone to limit all non-essential and international travel. The NCDC adds that avoiding large gatherings should limit the spread of the virus because it only spreads when infected people move around. More positive cases have come out of 8 states and the Federal Capital Territory, with the most infections reported in Kaduna State. Well, here's more on the NCDC update.
64 additional persons in Nigeria have been recorded as positive for COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 8 states and the FCT and indicate a rise from the figures reported 24 hours earlier. With 23 cases, Kaduna State had the highest number of infections, followed by FCT with 13 cases. Plateau reported 8 cases, Bauchi reported 6, Lagos came in with 5, and Rivers with 4. Bayelsa and Jigawa had 2 cases each, and Kano reported 1 case. Today's report includes backlogs of cases, recoveries and deaths from the FCT and Edo State. No cases were reported from Sokoto State. The total caseload in Nigeria has risen to 212,829. 74 more people were discharged, bringing the total number of recoveries to 204,335. There were 8 additional deaths from COVID-19 complications reported in the last 24 hours, increasing the total number of deaths to 2,914. Currently, there are more than 5,000 active cases in Nigeria, while over 3.3 million samples have been tested. The latest update from the National Primary Healthcare Development Agency shows that more than 5.7 million Nigerians have received a first shot of the COVID-19 vaccine, while over 3.1 million persons have been fully vaccinated. Globally, more than 7.3 billion vaccines have been administered. In Africa, there are more than 8.5 million confirmed cases and over 219,000 deaths recorded across countries on the continent. More than 250 million people all over the world have contracted COVID-19, while deaths are over 5 million.
Well, the coronavirus pandemic no doubt has affected the budgets of states globally, including Nigeria. As states prepare for the 2022 budget, there's a need to factor in strategies that will help fight the virus. Well, the Delta State government is taking a cue from this as the state ministries, parastatals, and agencies' budgets are screened by state lawmakers.
Many economies today have suffered due to the emergence and persistence of the dreaded coronavirus disease, affecting infrastructure development and general growth of various states. Delta State has had its own fair share of these hardships occasioned by the virus and is leaving nothing to chance in ensuring that the curve is flattened. Despite efforts put in place for sensitization on how to curb the virus, it appears people continuously let down their guard as they go about their normal businesses without observing the basic safety protocols. Marketplaces are now crowded with caution thrown to the wind, as people are seen moving about without the use of masks nor social distancing. The state government is, however, looking into how it can sustain its drive towards enlightening the public on the dangers associated with the virus and how it can be prevented.
Largely, COVID is handled by the Ministry of Health, But through the Ministry of Health, we're also able to access some funds for the purpose of educating our people on the right conduct to prevent the spread of COVID. So that is being done. We don't have any challenge with that. And don't also forget that there are also international donors that are also involved in the dissemination of information and sensitization of our people on the need to put up the right habit with respect to COVID.
Although vaccination is still going on in the 25 local government areas of the state, lawmakers in the state are in agreement with the development as they urge the people to continue to abide by the safety protocols.
We are doing every effort through SMSs, through social media and all of those areas to trying to reach to our people to be aware that COVID is still there. They should wash their hands properly, and then they should continue to wear their face masks.
There's a notion that, COVID-19 is not real. It doesn't exist. But for us, it is real. It does exist. And by the grace of God, you can go through the Delta State portal and you'll find out we have the least mortality rate from COVID-19 in Ughelli South State Constituency, Ughelli South Local Government Area.
According to the NCDC, Delta State has recorded a total of 4,144 confirmed cases, and of this number, there are 1,478 active cases. Over 2,500 have been discharged, with about 110 deaths recorded.
The Jigawa state government has allotted 32% and 16% of its total budget of 177.7 billion naira to the education and health sectors, taking almost half of the total budget. This was confirmed by the state governor Badaru Abubakar while presenting the 2022 appropriation bill to the State House of Assembly in Dutse, the state capital. According to the governor, education and health sector will engulf almost half of the budget, with both taking 48% of the total budget, and that's a sum of 85 billion naira, 57 billion naira, and 28 billion naira for both education and health sectors, respectively.
It will be important to point out that almost 85.88 billion goes to the key human development sector of education and health sectors, those accounting to over 48% of the total proposed budget. The education sector as a whole is allocated with 57.18 billion, representing about 32% of the total budget, which
Well, joining us now is Dr. Jamiu Ganiyu, a public health physician. Thank you for speaking to us on COVID-19 update. Let's begin with how realistic do you think is the 4 million vaccinations by Yuletide season, and how can it be achieved?
Well, thank you very much for that question. I think that is an ambitious statement and an ambitious target. You agree with me that to achieve that depends on the availability of vaccine. You have to also agree with me with the fact that Nigeria depends on COVAX, the African Union and other donors. And for instance, the bulk of our vaccine is actually from COVAX, that is WHO, and our other partners. And COVAX depends on Serum Institute of India to get supply. For some time now, for over 6 months plus, they have been challenged with production in India. Just of recent, they started making their production. And based on the latest finding, it appears that before there can be significant momentum as regards to exportation of those vaccines will be sometime January next year. So that target depends on how soon are we able to get supply of those vaccines. That's my basic challenge on that aspect of that statement. If there is availability, certainly we can hopefully achieve it using different strategies that is available. Thank you.
Well, speaking about vaccination, some people are complaining that they're told the AstraZeneca vaccine is finished and so they can't get a second jab. What should be done? What do you think should be done to, bridge this gap? What has happened to the vaccines?
Yeah, I think the issue has to do with operational challenge. What I mean by that is that, for instance, a vial of AstraZeneca can accommodate about 10 doses. So expectedly, I will appreciate the fact that when maybe you have a vial, you have to reserve it for 5 people so that you can eat. I need 5 people, essentially, so that each of them can take two doses. But I'm so concerned with what you just said now, that some people have first dose, that it has to do with operational issue, maybe logistic-wise. Those that are actually vaccinating, are not, they did factor some of those things into play before vaccinating people. So I think the appropriate authority actually need to look into that. And you all agree with me that you cannot give AstraZeneca, give Moderna. It has to be the same the same type of vaccine. So I think it's an operational thing. And I want to still believe that hopefully they need to look into it. Because so far, Nigeria has been giving close to about 8.8 million doses of different type of vaccine, on which currently about over 5.7 million people have been vaccinated. And that is with one dose, when over 3.1 million people had their second complete doses. So I think they need to look into it. It could be a case of operational problem. The respective national primary care development agencies and national and the state level, they need to look into that, because I don't think is an encouraging or it's a welcome idea for people to have their first dose and are not able to get the second dose. Thank you.
Now, when the J&J vaccine arrived, the authority said it would be for people living in rural areas because, it's just one jab. But how many rural people have been vaccinated with the J&J?
Well, actually, I cannot give you that figure now, because so far the data reporting pattern has been those that had one dose and those that have second dose. But I want to let you know for the record that for those people that are living in rural areas, hard to reach areas, riverine areas, they were advised, because of operational reasons, that they should be given the Johnson & Johnson. And since the first consignment was given to the country since August, I don't think we've had one. And it came from African Union, and it's about 177, which I don't think it's really make a huge significance as regards to the number of people that have been vaccinated. And the point again I want to say is that the agreement was that following the first consignment, it will be a kind of continual process every month to ensure that we have almost up to 30 million doses. But up to this moment, we're only able to have 177,000. So I think we are still far ahead. A way to go as regards to actually meeting our target. All in all, so far, the coverage so far for 2 doses, those that have completed, is about 1.5%, where those that have 1 dose is about roughly 2.8%. So we still have a long way to go as regards to achieving our targets with respect to COVID-19 vaccination in the country. Thank you.
All right, just finally, Dr. Ganiyu, with the current pace of vaccination and disregard for non-pharmaceutical interventions, would you say a 4th wave is imminent?
Well, I wouldn't want to. Nobody wants to say. Well, it's a possibility if actually people are not maintaining the non-pharmaceutical measure. But our belief is that to some extent it varies from one place to the other, especially in government facility and in private facility. There are some level of measures being put in place. But actually, if you are to look at it in all, based on the people's behavior, people not. The pattern of behavior in regards to the virus is a possibility that we can still have a solve. But the only thing we can do, since we are getting close to the Christmas period, New Year, government, we need to step our game to ensure, up our game to ensure that compliance is enforced, especially where places where we are, there is possibility of having mass gathering, and so especially in a place of worship, in marketplaces, in banks, and other outdoor activities. We just need to up our game to see how we can actually prevent the occurrence of such way. Thank
All
you.
right. All right, public health physician Dr. Jamiu Ganiu, thank you for speaking to us.
Thank you very much.
We'll take a short break on the program now. When we return, there's more on the global updates. Please stay with us. Welcome back to the program. We continue outside Nigeria. Mauritius has closed all schools as the number of COVID-19 cases continue to rise. The Education Ministry made the announcement in a statement on national television, mandating all classes to be held online from Thursday. The country has recorded 1,856 cases of COVID in learning institutions since October 18th. The Indian Ocean island has had a recent surge in the number of COVID deaths, with 42 occurring in the past week and 14 of them aged below 60 years. About 2/3 of the Mauritian population has been fully vaccinated. The health minister on Tuesday told Parliament that 61 fully vaccinated people had died in hospitals across the country since January. 44 of them had received Sinopharm injections, even as the government is encouraging citizens to take a third vaccine dose. Well, let's get an update on what is happening in the United States. Our Channels TV correspondent, Maria Bird, is joining us now. Hello, Maria. It's just a few days since the U.S. ban on international travel was lifted. Tell us what the mood is like and what, international travel looks like.
International travel is in full spectrum here in the U.S., and so many families are just overjoyed. If you just see the images of those who are coming together, who are rejoining their families for the first time, some in 2 years, and some even longer, because some families only see each other once a year or once every other year. And so maybe that COVID was the year they were going to see each other, and due to the travel restrictions, they were unable to. So you have families that are being reunited for the first time with new births of a family. Unfortunately, some families have had tragic deaths during the COVID-19 pandemic and have not been able to be together during those very tough times. And so you are just seeing, very happy, whether they're international travelers coming here or those who are American residents and are very happy to be able to be with their loved ones once again.
Well, with the vaccination coverage in the U.S., talk to us about, government's, the authorities' level of confidence, what it must have taken for them to reopen the borders.
Reopening the borders has been a real question and a contentious area. And we all know that it's only 33 countries that at this time have been allowed to have travel access to the U.S. And really what we looked at in the U.S. here was the number of cases compared to vaccination rates and obviously hospitalizations. And most states and most of those those epic areas have been seeing a decline. And so when that algorithm was at a place where we were seeing a downward trend for more than 21 days and kind of that consistent trend, that is really what led both policymakers and scientists to come together to say we might now be in a position to actually reopen the borders.
Now, what special precautions, if any, is the government taking to make sure this decision, does not backfire?
The government is obviously taking many precautions, whether it's the COVID testing that individuals have to have, along with vaccination. We know that the vaccine requirement is without a question, that is the number one piece that Americans are looking for, and especially those that are a part of those officials right there at the airports. They're going to be looking for that. Obviously, most of this information is uploaded prior to entry into the U.S., so that is one of the major pieces. There's also various security measures that people have to go through once they enter the U.S. Additional measures then were in place prior to COVID-19 for travel into the U.S. The continental U.S. And so I think that what we're going to begin to see is to really testing this out. I think at the end of the week, we'll begin to probably hear more of an analysis as to what went right, some of the challenges that existed, and then to see if there needs to be any curbing of that or if there needs to be any retraction. And I think we are a bit away from additional countries being added to that list. But I think that if things continue in this pattern, we will continue to see the U.S. opening its borders, especially as vaccination rates increase. And we know that children are now at a point of being able to be vaccinated. So that means that they might get closer to that herd immunity.
Well, it's interesting that you mentioned, the children's vaccination there. That's my next question. Talk to us more about that. How is that going?
Children's vaccinations are obviously, embraced by many that are already vaccinated. The parents themselves that are vaccinated, those parents of children are obviously extremely excited. And we know that many school systems, many school districts have already started to have outreach campaigns. They have these mobile vaccination trucks that are going through neighborhoods, sitting outside of school buildings. And so that's the way in which many children are being vaccinated, right there in their school parking lots. The greater challenge, though, is those parents that themselves do not believe in the vaccine, or those parents that are concerned about their children receiving a vaccine that has not yet been fully approved in the way in which they were hopeful that it would be. So that is where I think we're going to potentially see a greater challenge and when it comes down to the school districts requiring, which we know that many school districts will require, that children are vaccinated to stay in the public school systems and even some private schools in the U.S.
All right, then. Thank you, Maria.
Thank you for having me.
Well, South Korea is urging COVID-19 booster shots as severe cases hit record high, plus Singapore to charge people unvaccinated by choice for hospital bills. Well, here's more on this and other developments on our COVID-19 global update.
South Korea has encouraged citizens to get COVID-19 booster shots as more elderly people are infected, driving serious and critical COVID-19 cases to a record high. According to official data, total number of severe coronavirus cases jumped from mid-300s in October to 460 today, the highest since the pandemic began. Of the severely ill patients, more than 82% were aged 60 and older. Over in North Korea, the state media has reported shops being disinfected and health workers discussing antivirus measures. North Korea has not officially reported a single coronavirus case, but it has imposed strict antivirus measures, including border closures and domestic travel curbs. Singapore residents who choose to remain unvaccinated and subsequently contract COVID-19 will have to foot their medical bills from next month.
Our hospitals really much prefer not to have to bill these patients at all. But we have to send this important signal to urge everyone to get vaccinated if you are eligible.
Currently, the country foots the medical bills for Singaporeans, permanent residents and long-term pass holders. But this will change on December the 8th. Shops and malls in New Zealand's biggest city, Auckland, have opened their doors for the first time in 3 months as the city, which is at the epicenter of the country's coronavirus outbreak, gradually reopens. It comes amid a pickup in vaccination rates and due to mounting pressure from critics calling for more freedom. New Zealand still has among the lowest coronavirus cases in the world, with under 8,000 infections reported so far and 32 deaths. And finally, moviegoers in the Philippine capital are excited to return to the cinemas for the first time in 20 months, following further easing of coronavirus curbs after a downward trend of infections in recent weeks. Only fully vaccinated people can go to the cinemas, which must operate at a capacity of less than 50%.
Adherence to all non-pharmaceutical preventive measures of COVID-19 will help to curb the spread of the pandemic. Continue to take responsibility. Vaccines alone are not enough to keep the pandemic away. You can visit our website, channelstv.com, for more updates and better understanding of the pandemic, plus other stories. It's all at your fingertips. That's the COVID-19 update. Thank you for watching. I'm Layo Adegoke.